Good day, everyone. Welcome to our rationalization for uh, semifinal examination for Nloa 1. And I'm actually in charge of handling nursing practice 2, care of clients or healthy at risk mother, uh, care of pediatric clients with neurologic disorders. Question number 1. A 6-month-old infant is recovering in pediatric intensive care unit immediately following the placement of a ventricular peritoneal shunt or the VP shunt. The nurse notes the child's head circumference remains stable and the fontanelle is flat. Which nursing action is the highest priority when positioning this infant immediately post-operatively? A. Placing the child in high Fowler's position to promote maximal cerebrospinal fluid drainage. B. Positioning the child prone with the head turned to the operative side. C. Keeping the child flat and positioning them on the unoperative side. Letter D. Elevating the head of the bed to 45 degrees to facilitate neurological checks. Of course, if there are actually two options that are opposing, one of which is actually correct. So we will be choosing letter B and letter C. So letter A is eliminated, placing the child in a high Fowler's position to promote maximal cerebrospinal fluid. Remember, when after any neurological procedures, po- you need to position the patient on a lag roll, or the patient should be turned as one, or there has to be no flexion. So letter A is eliminated. A and letter D is the same because you're actually focusing on having flexion of the body. So that is actually eliminated. So the best answer for number 1 is letter C. That should be on the unoperative side. So it is part of your responsibility as a nurse to make sure that after or right after the shunt insertion, the child must be placed in a flat position on the unoperative side. So this unoperative side position will actually prevent rapid CSF drainage and avoid placing pressure on the valves of the newly inserted shunt. So if there is presence of rapid CSF drainage, that places the child for a subdural hematoma, and as what I mentioned, elevation of the head of bed should be gradual because that will actually increase the rapid CSF drainage. So the best answer for number 1 is letter C. Number 2. The nurse assesses a neonate whose parent reports a large, soft swelling on the baby's head following a difficult delivery. The nurse confirms the swelling is caused by a collection of blood between the bone and the periosteum, which critical which critical finding differentiates this condition from a caput succedanum. A. The swelling is associated with pronounced molding. B. The swelling involves the parietal area. Letter C. The swelling does not cross the cranial suture lines. Or letter D. The swelling is expected to resolve within 3 to 4 days. Of course, when we talked about uh, caput succedanum, it actually is defined that uh, distinguishes with cephalhematoma. No? So, of course, swelling caused by a collection of blood between the bone and the periosteum resulting from a secondary trauma, such as a difficulty of delivery, is actually a condition called cephalhematoma. And the defining characteristics of cephalhematoma, which distinguishes it from caput succedaneum, is that the swelling does not cross the suture line because a kappa succedanum is a soft tissue swelling that usually crosses the suture line and resolves quickly 3 to 4 days. So the best answer for number 2 is letter C. The swelling does not cross the cranial suture line. That is actually cap, letter C. That is a definition of uh, the condition. Number 3. A nurse is instructing a parent of a child beginning a ketogenic diet for intractable seizures. The nurse must emphasize the precise nutritional regulation required for this therapy to be effective. The parents demonstrate understanding when they state that the diet relies on which correct specific caloric ratio. A. Regulated protein and carbohydrate intake ensuring a 2 is to 1 fat to carbohydrate ratio. B. Limiting protein intake, ensuring 90% of calories are derived from carbohydrates. C. Limiting protein and carbohydrate intake, ensuring a 4 is to 1 fat to carbohydrate ratio. Or letter D. Unlimited fat intake with 90% of calories derived from protein sources. Of course, we know that a ketogenic diet is generally uh, absence is actually administered generally for the absence, kinetic or presence of myoclonic seizure. So it actually works by limiting the intake of protein and carbohydrate. So that's why it actually forces the body to use ketones, from the word itself, ketogenic. And the protein is regulated so that 90% of calories are derived from fat. Specifically, the fat carbohydrate ratio is 4 is to 1. It should be fat carbohydrate ratio, not protein and carbohydrate ratio. So it should be fat carbohydrate ratio of 4 is to 1. So when we say regulate letter A, regulate protein and carbohydrate intake, that is 2 is to 1, that's wrong. And then limiting protein intake, ensure 90% of calories derived from carbohydrate, it should be derived from fat. 90% should be derived from fat. And then unlimited fat intake, it should not be, because the stored energy is used through ketones or from fat. The best answer for number three is letter C. That is 4 is to 1 fat to carbohydrate ratio. Number three, letter C. Let's proceed to number four. The nurse is assessing a 2-month-old infant admitted with suspected bacterial meningitis, which clinical manifestation is the most critical to report immediately, as it suggests severe neurological compromise or increased intracranial pressure. A. Elevate irritability and fussiness. B. Alterations in feeding or sleeping patterns. C. Hypothermia or fever. D. Diminished levels of consciousness and depressed respiratory rate. Of course, if that is an infant, which is basically less than 3 months of age, the signs and symptoms of meningitis, specifically bacterial meningitis, that includes irritability, lethargy, fussiness, vomiting, and there is presence of building anterior fontanelle. However, it is considered to be uh, critical signs indicating a severe progression of a the condition and possibly increase in ICP, and of course immediate need for intervention, especially if that already is manifesting diminished level of consciousness and depressed respiratory state. So A, B, and C, expected po siya na magkaroon ang pasyente na meron bacterial meningitis. But if that already is present with the presence of diminished levels of consciousness and depressed respiratory rate, it actually signifies that there is this progression of the disorder. Number four, letter D. Let's now have number five. A 7-year-old child recovering from influenza flu-like symptoms or illness is discharged home. The nurse is providing instructions on avoiding factors associated with Ray's syndrome, which statement by the parent indicates the need for immediate correction and further teaching. A. We need to avoid all medications containing aspirin, especially during a viral illness. B. I will make sure he avoids taking Pepto-Bismol if he gets an upset stomach again. Letter C. For a headache or fever, it is safe to give him ibuprofen or acetaminophen, or D. I can use Excedrin for his minor aches and pains, since it's an over-the-counter medication. So we are taking into consideration here a mistake, because that requires a need for further intervention. So we know that Ray's syndrome is considered to be an acute life-threatening condition or encephalopathy that is generally present following a viral illness or a mild viral illness such as the condition influenza. And it is suspected to be linked with the use of aspirin. So letter A corrected kasi we need to avoid using aspirin. And the nurse must instruct the parent to avoid any salicylate such as the aspirin in children with viral illness. And then what is actually requiring for the statement here is letter D, because Excedrin is actually a medication that contains aspirin and it has to be avoided. So you can use Pepto-Bismol, especially if there is a stomach ache, and then you can also use ibuprofen instead of using aspirin. You can use ibuprofen or acetaminophen. The best answer is number five is letter D, because it still contains aspirin. Number six, a newborn admitted with a large myelomeningocele or neural tube defect, preoperative nursing management is initiated immediately after arrival, which intervention takes the highest priority regarding protection and integrity of the defect. A. Placing the infant in an isolate to maintain normothermia. B. Covering the sac with a sterile dressing, moisten with normal saline. C. Measuring the occipital frontal circumference to monitor for hydrocephalus. Letter D. Placing a towel roll between knees with hips slightly flexed and legs abducted. So for a patient with neural tube defects such as your myelomeningocele, the highest priority, especially in the preoperative phase, is to protect the integrity of the sac, and also that will be significant that you're going to prevent infection. So the nursing intervention for this is basically to cover with a sterile dressing, moisten with normal saline, and of course the other options such as isolate, uh, your measurement of the uh, occipital frontal circumference, and at the same time your positioning usually will uh, actually not very immediate in terms of preventing neurological defect, and it's not actually preserving priority. So the infant should be placed on the prone position to prevent urine and feces from contracting the defect, because of course it can promote integrity, internal integrity of that area. That's why you need to cover it with sterile dressing. Number six is letter B. Number seven. The nurse observes a 4-month-old infant suddenly drop his head forward while both arms and legs flex. The infant cries out and becomes pale momentarily. The mother reports a history of gestational difficulties and developmental delay. The nurse recognizes this event as consistent with which specific seizure type? Is it A. Febrile seizure, B. Focal or localized seizure, C. Infantile spasm or Salami seizure, or D. Status epilepticus? Of course, the manifestation of that patient is actually a sign of infantile spasm. So this spasm typically is going to begin around 3 months of age and are associated with the history of gestational difficulties or developmental delay. And of course, the defining manifestation is a sudden drop of the head forward while both arms and legs are flexed, and of course that potentially is accompanied by crying and changes in skin color. We know that febrile seizure occurs 5 to 6 months, or 6 months and 5 years, and are associated with rapid temperature changes. And if there is presence of status epilepticus that is generalized and prolonged tonic-clonic seizure without regaining consciousness. Number seven, answer Charlie. 8. The parents of an infant diagnosed with microcephaly are asking the nurse what interventions will be utilized for their child. The nurse appropriately counsels the parent that primary intervention for microcephaly is A. Providing varied positioning and potentially applying a helmet between 4 and 10 months. B. Post-operative management following surgery done before 6 months to correct skull deformity. C. Monitoring occipitoparental circumference regularly and providing supportive care. Or D. Applying pressure bandages and administering analgesics postoperatively to reduce swelling. Of course, we know that a microcephaly is actually referring to a small brain. So nursing interventions that is focused for microcephaly includes monitoring for the occipito, occipitofrontal circumference, and that is around the fullest part of the head, just above the eyebrows, and also providing supportive care. So we know that option A are interventions for plagiocephaly, and we know also that option B and D that is related to management of craniosynostosis, which is basically the early closure of the cranial suture. So answer for number 8 is letter C. Number 9. A neonate is diagnosed with cerebral arteriovenous malformation. The nurse understands that AVMs involves a web-like tangle or vessels where the cerebral capillaries fail to form, leading to high-pressure blood volume and dilated, thin-walled vessels. Because of this alteration in cerebral circulation, the neonate is at risk for the development or developing which primary systemic complication? A. Acute renal failure, B. Intractable seizure, C. Congestive heart failure, or D. Severe migraine-like headaches. Of course, if there is arteriovenous malformation, that can usually result in possible several complications, and that includes ischemia. That will also include intracranial hemorrhage, and also including congestive heart failure. So the sources of heart failure and cardiomegaly are key assessment in neonates with AVM, And of course, when you talk about seizures and migraine-like headaches, are considered to be assessment findings that is more typical in older children with AVM, but not on a neonate. So the best answer for number 9 is letter C. Number 10. A nurse is conducting a neurological assessment on a 9-year-old child admitted with possible hydrocephalus, which manifestation is a classic sign of increased intracranial pressure in an older child, differentiating the assessment from an infant. A. A high pitched cry. B. Bossing of the forehead. C. Headache on awakening. Or D. Prominent scalp veins. Of course, when we talked about increased intracranial pressure, especially for patients with hydrocephalus, that child signs of hydrocephalus, especially for child and adolescent, includes headache. There's also presence of uh, nausea. There is vomiting, irritability, and impaired judgment. So the patient is having headache on awakening is considered to be a hallmark sign of increased ICP in an older child. Presence of high-pitched cry, bossing the forehead, and prominent scalp veins are signs typically seen in infant with hydrocephalus. Number 10, the best answer is headache on awakening. A and ABD are signs for an infant with hydrocephalus. 11. The school nurse is creating an individualized care plan for a child with current tonic-clonic seizure to ensure the child's safety and prevent injury during seizure activity. Which intervention must the nurse include in the plan? A. Instruction to avoid wearing a medical alert bracelet as it can cause injury if snagged during seizure attack. Letter B. Encouraging the child to wear a protective helmet during activities outside the classroom. Letter C. Restricting the child from all typical education classes and outdoor recess activities. Letter D. Ensuring the child carries prescribed medications in a fanny pack at all times. Of course, when you're talking about this management, include the plan of care, the best answer is letter B. Letter C, eliminate because that's absolute all physical education. Letter D is also eliminated because it's absolute all at all times. So, for a child who suffers from recurrent seizure, it is actually considered to be important for you to encourage a child to wear a protective helmet. The child should also be instructed to avoid contact sports and swimming, and of course, instructed as well to wear a medic alert bracelet. 11. Bravo. 12. A 13-year-old child was successfully resuscitated after a near-drown incident in a nearby swimming pool and is currently minimally impaired but stable. The nurse educates the parents on potential long-term risk. The most important complication for the parents to monitor for in the days immediately following the event is profound laryngospasms leading to dry drowning, B. Secondary drowning leading to rapid respiratory deterioration. Letter C. Hydrocephalus caused by sudden changes in intracranial pressure. Letter D. Pediatric severe hypothermia require immediate rewarming interventions. Of course, the best answer here is letter B. The script near drowning is considered to be survival for more than 24 hours regardless of outcomes applies. The critical risk following successful initial resuscitation, even if the child is minimally impaired, is secondary drowning, which is defined as the rapid deterioration of respiratory function from several hours to several days after successful resuscitation. And if there is dry drowning, there will be presence of laryngospasm that prevents fluid aspiration, and severe hypothermia are acute risks during or immediately after the incident. So number 12, the best answer is bravo. So thank you very much. Congrats to everyone.